Hello, my name is Sandra Walters. This is a PowerPoint presentation on Dorothea Orem self-care theory. Dorothea Orem has a general theory as one of the general grand theorists of nursing. She had three different areas for self-care. One was self-care, the self-care deficit, and the nursing systems. Her self-care theory was the practice of activities that individuals personally initiated and performed on their own behalf in maintaining health, life, and well-being. The self-care agency, it was a complex ability to meet one's continuing requirements for care that regulates life processes, maintains integrity of the human structure and functioning of development, and promotes well-being. Basic conditioning factors that affect an individual's ability to engage in self-care is the age, gender, developmental state, health state, social, cultural orientation, family system factors, resource adequacies, and availability. Some of the major assumptions of the self-care theory. People should be self-reliant and responsible for their own care and others in their family needing care. People are distinct individuals. Nursing is a form of action and interaction between two or more persons. Successful meeting universal and development self-care requirements is an important component of primary care prevention and ill health. A person's knowledge of potential health problems is necessary for promoting self-care behaviors. Self-care and dependent care behaviors learned within a social, cultural context. The concepts of self-care theory is that nursing is an art, helping service and technology. It's actions deliberately selected and performed by nurses to help individuals or groups under their care to maintain or change conditions in themselves or their environments. It also encompasses the patient's perspective of their health conditions, the physician's perspective, and the nursing perspective. Also, there's a goal of nursing to render the patient's self-care needs, to maintain the state of health, to regain normal or near normal state health in the event of disease or injury, to stabilize, control, or minimize the effects of the chronic poor health and disability. There's universal self-care requirements, and they're associated with life processes and the maintenance of integrity of the human structure and functioning. It's common to all people, which is the activity of daily living. The universal self-care requirements identify these as maintenance of self-care, a sufficient intake of air, water, and food, provision of care associated with the elimination process, the balance between activity and rest, between solitude and social interaction, prevention of hazards to human life, well-being, and the promotion of human function. Also, with the development self-care requirements, it is associated with the development of processes and derived from a condition or associated with an event, such as adjusting to a new job or adjusting to body changes. The theory of nursing systems. It is the ability of the nurse to aid the person in meeting current and potential self-care demands. It is focused on the person. It has three support modalities identified in theory, including total compensatory, partial compensatory, and education and supportive compensatory. The client's ability for self-care involvement will determine under which support modality they will be considered. Also, the nurse's role in helping the client to achieve or maintain a level of optimal health and wellness is to act as an advocate, redirector, support person, and teacher, and to provide an environment conducive to the therapeutic development. Orem and her self-care theory is used throughout nursing, in the nursing process, to help people to be able to return to that function of activities of daily living. This concludes my video on Orem has self-care theory. And hello, everyone. All right, my niece. Yes.